For joining our webinar. My name is Dr. Dayan, here in conjunction with Dr. Spiro Theodoro from New York City. Very excited to tell you about new hands-free technology by InMode, which is really a one-of-a-kind, all-in-one EMS skin tightening as well as fat reduction device. I owe a lot of credit to Dr. Theodoro and Dr. Chia. They came to visit back when I was in training at the Harvard Plastic Surgery program, and they gave a really interesting lecture about minimally invasive and non-invasive technology and how they've built a booming practice around this technology. And I became very interested in it and learned quite a bit from them over the past 6 or 7 years. I used to travel there frequently and learn from them. We recently put together a book on emerging technologies in face and body contouring that's coming out by theme in the coming weeks. Really, the trend is quite clear. If you look at ASPS statistics, excisional procedures are up 100% over about the past 20 years. But really, non-invasive and minimally invasive procedures are up 6 times that. And if you look at the American Society of Aesthetic Plastic Surgeons, there's been a 1,500% growth in non-surgical procedures since 1997. And it's a clear trend. When you go to the Apple store, you're not asking for the iPhone 6, you want the iPhone 11. And patients are the same way. It's very important to them that we have the most recent technology that works and that they get a result with minimal downtime. This is my office, and we've really built a practice on minimally invasive and non-invasive technologies that work. The key thing here is to really define who our population is. And I think we can look at it as 3 different groups of patients. We have the young patients who benefit from things like skincare, fillers, Botox. And then on the other end of the spectrum, the older patients really need an excisional procedure to remove skin laxity. But there's a group in the middle, which we call the treatment gap, that really hasn't fallen into either category. And this is really the group that we can impact most with minimally invasive and non-invasive technologies. The treatment gap continues to grow, and this is largely attributed to social media. More and more patients are on social media and are comparing themselves to others. Now, looking at non-invasive body contouring devices, this is the largest area in aesthetics currently. There have been 31 devices that have received FDA 510(k) approval between 2012 and 2018, with the largest number in 2016. Here you can see the indications, which are rapidly increasing, as well as adverse events which have actually been quite favorable, with majority of them being superficial and temporary. Now, despite this being the largest area in aesthetics, there are really a number of core unknown factors here that we have been actively researching. For example, is it cryolipolysis or is it radiofrequency, cool or heat? Are we focusing on muscle or on fat, and which one is more important? So there are a number of unknowns in this space. When you look at the current technology in non-invasive body contouring, it's primarily focused around radiofrequency, EMS, and cryolipolysis. And again, this is the largest growing area within the aesthetic industry. Now, a key thing to understand is that our patients do not look like the models on the left. Our patients come from all different places, all different shapes and sizes, with different aesthetic concerns. So it's very important that we customize our approach and solution to these patients because of their diversity. Now, who likes pizza? If you look at the history of pizza, it really began in antiquity with the basic flatbread that was made in the tabboon. And the modern day pizza was actually really started in Naples when tomato sauce was added to focaccia in the late 18th century. And the precursor of this was the flatbread that the Romans had, and then eventually toppings were added. And this is a flatbread in the tabboon that was historically made. And, as we evolved, tomato sauce and toppings and cheese were added. But imagine if you went to a Pizza Hut and they tried to charge you individually for the flatbread and then for the tomato sauce and the cheese and the toppings. You would say, I'm used to a fully loaded pizza at one price. And really, the aesthetic patient is quite similar. There's different components to the aesthetic patient, and we deal with skin laxity, fat excess, and muscle hypoplasia. And these are really the core factors of what our aesthetic patients are comprised of and the areas we need to consider. Now, when I started off in practice, I felt very much like this. I knew that technology was an important component of practice because patients wanted little downtime, and real results with minimally invasive and non-invasive technology. But it's really difficult to navigate this space, and all these devices are expensive. So really being smart about it and knowing what is going to give you the results you need to have happy patients can be challenging. Now, these are a number of different non-invasive devices out on the market. And the concern is if you get one device and that's all you have, you may apply it inappropriately or to the wrong patient or to the non-ideal patient, and as a result, be left with non-ideal results. So CoolSculpting, which is a popular device, is a cryolipolysis device for fat. And if this is the only device you have, inevitably a patient is going to come that has some skin laxity, and you may try to apply this device. And unfortunately, it does nothing for skin laxity. In fact, reducing some fat with lax skin may make the skin laxity worse. Or for example, an Emsculpt device, which is focused on EMS, and you may have a patient with excess fat or excess fat with skin laxity. And again, you may fall short if you try to apply that to the non-ideal patient. So thinking of what is really the ideal aesthetic device that can allow us to customize and tailor our treatments for all our patients. And what that ideal device would be, first of all, a safe and efficient device that patients see a real value in, a device that we can put on our patients and not have to manually treat them with. And it would be a device that would treat all those components, skin, fat, and muscle. Ideally, it would treat it synergistically with a little to no disposable cost. Now, our aesthetic patients come in all different shapes and sizes, so we need a device that really treats all three of these components. The Evolve device does all of these things. So it has a module for skin tightening, fat reduction, and muscle stimulation. And I'd like to go through those different modules and talk about the technology and the results. So control of thermal energy is key. And just like bocce ball, radio frequency works through generation of thermal energy. And just like bocce ball, you want to get right up to the appropriate temperature without exceeding it. A lot of the other previous devices didn't have good temperature control. So either you fell short and didn't have a result but were very safe, or you surpassed the limit and had potential for burns. So control of temperature is really key for an efficient treatment and a safe treatment. Now, temperature versus time is a very interesting area. Here you can see this is an Arrhenius equation, where this is soft tissue remodeling and tightening. And you can either tighten at a high temperature for a short period of time, or you can tighten at a lower temperature for a longer period of time. And it's actually been shown that having a lower temperature for a longer period of time is more effective for collagen stimulation. And that's exactly what this device does. So if you categorize our patients, certain patients need muscle building, certain patients need fat reduction, and certain patients need a combination of these with skin tightening. So the Evolve Trim is a fat reduction device that's part of the Evolve system. And what it is basically 6 applicators, just like you see here. And it does a number of things. You see these little holes here provide a vacuum suction, which suctions the soft tissue into this chamber and applies bipolar radiofrequency energy, and also provides an electroporation, which is a high voltage wave that essentially puts holes in the fat cell membrane to damage them and cause fat cell death. And as you can see here on the right, these applicators can be customized and placed in different areas, so it really allows you to treat patients in a very individualized fashion. Now, vacuum suction actually allows for a deeper penetration of radiofrequency, more efficient penetration, and we've seen on biopsies as well as electron microscopy the effect on these cells. Another important factor here is because we're using radiofrequency energy, we're heating the tissue, which allows for some soft tissue contraction. So it's not only a fat reduction technology. And this heat is a volumetric type heating that really stays in the tissue for a significant period of time after treatment, which really enhances the result. And here you can see another example on the arm. This is using near-infrared thermal imaging, where even 15 minutes or 30 minutes after treatment, you still have a a signature of heat that really remains in the tissue. The Evolve Tight is the skin tightening module of this device, and here you can see there are 8 applicators which are individually plugged in, and they are bipolar radiofrequency energy where you have energy moving from the central electrode to the external electrodes in a bipolar fashion. And really the important thing about this technology is there's a very tight temperature control, and it's automated, so the device knows exactly what temperature each applicator is at, and you set that temperature and it controls it and extends it in a very consistent fashion. So here you can see the applicator is being placed on the abdomen, for example, and again you can customize these and put them in different places. And here you can see the interface of the device where you set the temperature, and you can see it's color coded. Within 2 or 3 minutes you reach target temperature and maintain it for the duration of the treatment. So this technology moves from the central electrode to the external electrodes and allows for new collagen formation, elastin reorganization, and overall improved remodeling of the soft tissue. We've taken biopsies using this technology that shows a thickening of the collagen and reorganization of the elastin. And here you can see how customizable this really is. As our patients come in and they become more diverse and their aesthetic concerns are differing, it really allows us to customize our treatments. Now, EMS is quite interesting. If we all go back to our basic muscle physiology, we have a motor unit, as you can see here. And the motor unit basically comprises of a nerve and the innervated muscle fibers. And it's just like being pregnant. Either the muscle fibers contract or they don't. You can't be sort of pregnant. You're either contracting the muscle or you're not. And this is an area where marketing for different devices has really confused the science because all we have is a nerve, and it has sodium-potassium channels that have to be activated in order to fire the motor units. And the motor units are recruited basically, and to sustain a contraction, you have to fire these motor units at different times to allow for that sustained contraction. So that's muscle physiology. Now, what matters more, fat or muscle? The subcutaneous fat on average comprises about 25% of the human body, whereas the muscle composition is about 40% in men and 35% in female. So muscle composition is actually a bigger part of our mass. Now, synergy is an important concept, and this device really leverages the 2 different modules to allow for a synergistic effect. So 1 + 1 doesn't always equal 2, and in this case, it can equal more than that. So this is the first device to combine preheating with EMS to allow for a synergistic and more efficient muscle contraction as well as result. So EMS actually produces a supramaximal contraction that we could not achieve voluntarily. And the muscle basically hypertrophies as a result of that. And we also get some fat reduction in the adjacent tissue as a result of the muscle hypertrophy. So here you can see in other studies on EMS, there has been a demonstration of fat reduction, muscle growth, and reduction in the diastasis recti. So this synergistic effect works on a theory that's called thermal acclimation, which has been used by professional athletes for many years. And what it means basically is the rehabilitation of muscle and efficiency of muscle is much greater when you're preheating. So you could think of hot yoga, for example, or many professional Olympic athletes train in hot environments to allow for a more efficient muscle contraction. And ultimately, in relation with EMS, you end up getting a faster recovery and a more significant result. Another thing about this heat injury is that at a temperature of 43 or 44 degrees Celsius, it has been shown in a number of studies that we're having apoptosis of almost 10% of the adipocytes, and this has been biopsy proven. So radiofrequency in combination with EMS is quite powerful. Now, EMS has been shown to cause an extreme metabolic reaction that decreases the number of nuclei in the fat cells and ultimately kills fat cells. So a lot of this has been done showing damage and stress to the endoplasmic reticulum, which is the mechanism for apoptotic acceleration of the fat cells. So if you look at EMS and the science of it, if you look at the free fatty acid concentrations, after treatment, the free fatty acid levels in the blood increase, demonstrating death of fat cells, and also the pH decreases, demonstrating a lactic acidosis as as the muscle stimulation becomes more and more intense and significant. So RF radiofrequency in combination with EMS really optimizes muscle stimulation and synergistically reduces fat. This particular here, you can see the applicators of the EMS for the Evolve device. There are 4 of them, and again, they can be customized and placed in different areas of the body. The intensity level is maximized at 50, which is quite intense. We have a number of jiu-jitsu instructors and very athletic patients who can tolerate usually between 20 and 30 intensity, and it's a biphasic waveform. Here, most importantly, I want to show some results. This is after 3 treatments. We use some of the most sensitive research cameras to demonstrate results objectively, and this is the Quantificare camera, which really gives a very accurate volumetric representation. And you can see after 3 treatments of the Evolve system, an almost 755 cc reduction of abdominal volume. And here you can see that on the lateral view. Another patient with a 500 cc on the anterior abdomen and 350 cc on the flank. Another patient, 300 cc in the lower abdomen reduction. And this camera is quite sensitive. If you took a picture of a patient's face and injected 1 cc of Voluma on the left cheek and then took an after photo, it would show you that there was an additional 1 cc added to the left cheek. So it's really quite sensitive. Here you can see the lateral result after the 3rd treatment. Another patient, 230 cc reduction. So there's really no question that radiofrequency EMS, both in the tight, trim, and tone applicators, are synergistic and really quite efficient. The treatment is quite comfortable, and we really haven't had any adverse events as a result of it. So in conclusion, for the first time, we have a device with 3 modules that tighten skin, reduce fat, and stimulate muscle. It works synergistically all on one platform to treat and customize our treatments for our aesthetic patients. Thank you very much for your attention.